And I think that's what we're going to be talking about here on the Independent Republican Mike Graham for some time to come. As we will be probably about the NHS, because the NHS waiting list has been a sick joke for years now. The Health Foundation, which is a think tank, reckons it could hit 8 million by summer next year, even if there are no strikes. And if the strikes do continue, the list could be another 180,000 higher. What we know is that junior doctors and consultants have been on strike quite a lot this year, sometimes at the same time. They're having more meetings apparently with the government at the moment, but if they haven't resolved their dispute by November the 6th, which is only a week on Monday, there are going to be more strikes. I'm joined now by independent statistician, our favourite statistician, in fact, Mr. Jamie Jenkins from Welsh Wales. Jamie, a very good morning to you.
Good morning, Mike. How are you doing?
Yeah, very well indeed, very well. This comes as no surprise to me because you and I both know, and you know in Wales where the NHS waiting lists are even worse than they are here, there's absolutely no end in sight for people getting seen on the NHS because there's simply not enough proper people doing proper jobs in the organisation. Only just this week, Carol Sikora put out a tweet suggesting that it was a bit of a mistake under the problems that they've got at the moment, to start advertising a job for some kind of diversity champion for about 120,000 quid in some health trust in England.
Oh no, Mike. We've had plenty of these diversity jobs, and remember, because there's different trusts across different parts of England, they all seem to want these kind of diversity roles. But the problem that you're talking about again today, Mike, we've talked about it in the past. You will be talking about it in the future. It's pretty much at the hands of the last 20, 30 years worth of government. So Jeremy Hunt, the Chancellor, was Health Secretary for a while. And we saw this coming in a way. If you look at the data, as a statistician of what I am, we've got a huge number of people who were born just after the Second World War, Mike. What you call the post-war baby boomers. Now they're all hitting about 75, 76, 77, 80. And we know that the number of people who need healthcare, kind of the percentage chance of you going into the NHS increases quite high when you get towards 80. So they have this huge number of people coming through. But have we done anything as a government in the UK, knock-on effects to Scotland, Wales and Northern Ireland to prepare for this? Absolutely not. And they're now talking about an NHS workforce plan for the future. But you can't just magic doctors and nurses overnight, GPs overnight, Mike. No wonder the NHS waiting list is going to get worse. Yeah. You could say it's not Sunak's fault because this is, David Cameron, Tony Blair, Gordon Brown, all those politicians before him who haven't put the plans in place. So it's a difficult one for him. But yeah, this is no surprise, Mike.
Well, do you know what? I actually take a different view to that, Jamie. I say that this has nothing to do with Tory austerity cuts. It's nothing to do with Tony Blair putting a huge debt mountain on back of the private finance initiative to build hospitals. It's all about the people who work in the NHS who don't know what they're doing. Because you've got this huge burgeoning organisation. I think it's one of the biggest organisations in the entire world. At one point, I was told that only the Red Army employed more people, And in the end, they've got 200 billion quid a year, and yet they somehow run out of money every year. And every single winter that comes along, I'm just waiting for the crisis to be announced. The winter crisis is coming. Another 24 hours to save the NHS. Year after year after year after year, they waste all the money they get given. They hire more people than they need to do non-clinical jobs. They allow doctors and nurses to work in the private sector at the same time. Somebody needs to take a grip of this organisation and fix it because it ain't working. And it's not the politicians' fault.
No, I would agree with you on that, Mike. I think what you've hit the nail on the head is that, all this money goes into the NHS, but how much of it is getting on people that you would want? So 120,000 diversity officer is not going to be saving lives. You can get paramedics, you can get ambulance drivers to do those roles. And then you look at the number of working days as well. It's not a 7-day NHS. You look at GPs, Mike, if you want a GP appointment, I was looking at the stats on the GP appointments that come up yesterday from NHS Digital. Yeah. They even put on there was 21 working days in the month. Well, if you want to really get a grip on all of the health problems, why aren't they working every single day? Why aren't we getting enough people? You TalkTV doesn't switch off on the weekend. No. Mike, why do the GPs?
Well, exactly right. Well, nothing does. This is my point. Whenever I've come into work at a weekend, which I used to do a lot more than I do now, I walk past Guy's Hospital every day. When I park my car, I walk to the office. At the weekend, you would think there was literally nobody sick. There's no ambulances in sight. There's literally nobody standing around waiting to go in. There's nobody on wheelchair duty. There's nobody visiting because there's just no people. Almost as if is, you know, there isn't anybody going in and out. There's a sort of skeleton staff. They call it when they go on strike, you know, a Christmas Day service, i.e. no service at all. And it's just incredible to me that they operate in this ridiculously antediluvian manner as if we're living sometime in the 1950s.
Yeah, and the thing is, Mike, Starmer did the recent Labour Party conference, and he's reiterated what he said, you know, many times over the last 6 to 12 months. Looking at the polls, looking at the bookies, mate, Mike, he's pretty much odds on to win this next general election. And he said recently, you know, in the last 12 months, that Wales is a blueprint for what he will do across the UK. And there's something you've already raised there, Mike. If you look at the NHS waiting lists and percentage of people who've been on that waiting list for a year, because obviously it's bad news if you're on there for 1 month, 2 months, 3 months, over a year, you know, you've been sat there waiting to see somebody for that treatment. In England, it's bad. It's about 5.1% of people on the waiting list have been there a year. In Wales, Mike, it's closer to 20%. So is Starmer the answer? I think no. I think what you've said is a complete rip-up of what the NHS blueprint is, complete overhaul of it, less of these diversity jobs, Mike, more ambulance drivers, more paramedics, more frontline people. You know, a diversity person in the NHS at a senior level is not going to fix you.
Yeah.
That needs to be stopped.
Yeah, also more of an actual friendly attitude towards the customers of the NHS, i.e. the paying public, because everybody goes on about, oh, it's free at the point of use. Well, it's not free because they tax you in order to pay for it. So let's forget that it's free. But rather than telling us all that we should be healthier so we don't have to trouble the NHS during our lives, they should be actually just helping people to get better when something bad happens to them. But, you know, you say it's more like 20% there in terms of the people waiting. They've got some obsession with the number 20 in Wales because they're now making everybody drive at 20 miles an hour. And there's a magistrate who's come out this week to say he doesn't want to prosecute people anymore because it's too embarrassing.
Oh, Mike, the Welsh Labour government are making us a laughing stock, pretty much. Yeah, he's quit because he basically said that this 20-mile-an-hour policy, and if he has to start prosecuting people for going, you know, 2 or 3 times over, you start ending up in court when you tot up the points. He called her a sledgehammer to crack a nut. And our climate change minister was talking this week, Mike. She said that she drove from South Wales all the way to North Wales, and the 20-mile-an-hour policy had no impact on her journey time. She actually cited the main cause of any disruption was flooding and climate change. Now, why is the climate change minister driving from South Wales to North Wales, Mike, when we got an entirely good train service that the Welsh government own? You just can't make it up, Mike. These politicians, where are they getting them from? And if Labour Party in Wales is a blueprint for the rest of the UK, Mike, you can have lots of these politicians getting elected into Westminster. So, you know, good luck, I think, to England over the next 12 to 18 months, Mike.
Yeah, well, I mean, good luck in parts of London driving as fast as 20 miles an hour because the congestion zone doesn't seem to have stopped the congestion. In fact, if it's done anything, it's made it bleeding worse. But, Jamie, good to see you. We've got to run. Thank you very much indeed.